Good afternoon, patients of Soundbridge Dental Sleep Apnea Therapy and those of you that follow us on YouTube, Facebook, and Twitter. Dr. Karina Ireki here, and we're here today to talk about a topic that I find very interesting is asthma and its correlation with obstructive sleep apnea. It's been about a month since I've posted a video, and I apologize for that. I like to get videos out more frequently. We've been very busy in the office. This is sort of the time of year that people have met deductibles on their medical insurance, and so they're looking to get diagnosed and or treated so that they start 2021 off with good quality sleep and a good strong immune system, since we're all living in this age of COVID. So it brings me to the point of this is a really good time of year, particularly if you've met your deductible, for you to be diagnosed or have a sleep study done if you do suspect that you do have an issue with quality of sleep, and for you to have obstructive sleep apnea treated if you have been diagnosed. Your out-of-pocket expense will be less at this point if you have met your deductible or you're close to meeting your deductible. Anything that is not complete by, in our case, our office closes December 22nd, so anything that is not complete or delivered by that time will roll over into the 2021 insurance year, and so deductibles kind of reboot at that time, and your out-of-pocket expense for any diagnosis or treatment will be more significant at that time. So I urge those of you who have been questioning having a sleep study done, get it done now if you've met your deductible. Again, out-of-pocket expense is less significant, and the same thing with treatment. Those of you that have been diagnosed but have been putting off treatment, met your deductible, this is the time to be getting in and getting that treatment completed. All right, let's talk about asthma. I found this topic interesting and wanted to get it posted earlier. Asthma and obstructive sleep apnea, how do they correlate? So what prompted me to start thinking about this was during several weeks ago when we had all of the forest fires on the West Coast. The air quality was horrendous. It was like there was a constant fog outside and it was all smoke. So you can imagine people who suffered with asthma and breathing issues were not doing well during that time. And I had several patients coming in saying, well, my asthma has kicked in, or, I'm having trouble breathing because of the air. And so my sleep has not been as the quality of my sleep has not been as good. So how do asthma and obstructive sleep apnea, how do they fit together? Well, in the health profession, we consider asthma and obstructive sleep apnea an overlap syndrome. And what this means is there is if someone has asthma, their chances of having obstructive sleep apnea are greater. So what is that percentage? Well, for a person who has asthma, they have a 40% greater chance of having obstructive sleep apnea. Think of that as sort of a baseline. If you are an asthmatic who is controlled, that percentage goes down. If you are an asthmatic who is poorly controlled, that percentage goes up. So, take-home message is, if you are an asthmatic, it is prudent that you have a sleep study done to make sure that your quality of sleep is as it should be. If you have a sleep study done and you have obstructive sleep apnea, it's really important that you have that sleep apnea treated, because that treatment of sleep apnea can decrease your asthma. At the same time, it's really important that you have your asthma controlled so your sleep apnea is not as bad. So, huge correlation between the two. Really important if you have asthma that you rule out sleep apnea, and that you make sure that both are managed and controlled appropriately. The other thing I found interesting is that for those of us that have a BMI greater than or equal to 30, our chances of having, as we know, obstructive sleep apnea are greater, but also our chances of having asthma are also increased. So the thought is that belly fat produces inflammatory substances that can affect the whole body, but for this sake of this discussion, can affect the lungs, causing asthma. So asthma is an inflammation in the bronchioles, in the airway, that prevents the exchange of oxygen from the lungs to the circulatory system. And this prevention is of this crossover of oxygen from the lungs to the circulatory system is all due to inflammation. The bronchioles are inflamed, they constrict, sometimes they produce mucus. So there's a lot going on there with inflammation that prevents this working of the lungs and the circulatory system together. It prevents them from working effectively. So now let's throw in obstructive sleep apnea. So now you've got the sleep apnea, you've got less oxygen coming in at night because you're not breathing, you've got the inflammation of the bronchioles. We know obstructive sleep apnea promotes inflammation. So you've got this perfect storm. So obesity, asthma, sleep apnea, all work in correlation. If you do not have a BMI greater than 30, you still have that asthma component and sleep apnea. Really important to get all of that treated. I bring in the obesity piece because my next video is going to be on weight gain and winter. We all know that winter's a time we kind of hunker down anyway. Weather isn't as great. It's kind of less conducive to getting outside and being physical and exercising. So in the next video that I post, we're going to talk about weight gain, and I'm going to challenge those of you to a November-December challenge. My fear is that not only because the holidays and winter, but with all of us really being quarantined because of COVID, I don't want everybody to become couch potatoes. I know that's really easy. And just like we did back in March when everything really shut down, we had a challenge and we had winners of that challenge. So I want to do a November-December challenge for patients of Soundbridge dental sleep apnea therapy and anybody else that would like to join in. But our challenge, I will post that on my video next week. And it's going to be for, like I said, November, December during the holiday time. And one thing that I want you, kind of a little hint, is I want you to think about what is, during those 2 months, what do you think would be your biggest craving as far as unhealthy food? Is it Christmas cookies? Is it fruit pie? Is it pumpkin pie? It's whatever you think is your sort of downfall. I want you to figure out how many calories one serving has. You don't have to be exact, but how about how many calories one serving has? And then how much physical activity would it take to burn off one serving? So that's your little hint. And then at my next video, we'll talk about our challenge for November and December. Last but not least, I want to encourage those of you who love to read. There is a book that's called Breath by James Nestor. And I have it. I have not had a chance to read it yet. I have 2 other books that I'm kind of in the middle of, and that's a stretch for me to be reading more than one book at a time. But it is the next on my list. And but I was fortunate enough with the study club that I belong to that we had James Nestor as a speaker last week. And he wrote this book, Breath, which is on the New York bestseller list. Very interesting content. It is about breathing and how we've lost the art of breathing through our lifestyle, through the types of foods that we eat, and consequently how the lack of good, healthy breathing is affecting our overall health. And this just isn't obstructive sleep apnea. We're talking even breathing during the day. So I encourage you, if you're looking for a book to read, the name of the book is Breath, James Nestor, and it is on the New York bestseller list. So it's a great book. I'm looking forward to reading it. When I do read it, I will give you some information in detail, but again, it won't be like reading the book yourself. So I encourage you to also get that book and dive into the art of breathing and how it can affect your overall health. All right. Thank you all very much. I'm so glad that I got to spend 10 minutes with you. If you have any questions at all regarding asthma, regarding our challenge, or wanting to get in and get your sleep apnea treated because you've met your deductible, the office number is 253-514-6076. We look forward to hearing from you, and look for that video next week because we will be talking about weight gain during the winter months. Take care.